My name's Emily Bednar. I'm an adjunct faculty member in the nursing program here at St. Ambrose. I'm also a nurse practitioner. I work in an outpatient office in Moline. After I graduated with my bachelor's degree in nursing, I went to work as a nurse for Trinity Medical Center in the Quad Cities. I worked on an inpatient unit there for 2.5 years. During that same time, I went back to school and got my master's degree as a nurse practitioner. I graduated with that in May of 2007, and I started teaching for St. Ambrose part-time in the nursing program. And after I passed my boards as a nurse practitioner, then I went to work in an internal medicine practice in an outpatient clinic as a nurse practitioner. Well, in healthcare, a typical day really varies because people don't really plan to get sick or get sick on schedule. But in a typical day, I probably see about 15 patients. Some of them are for routine planned visits like physicals and checkups. And then a lot of them are acute illnesses. People have gotten sick or just don't feel well. I spend a lot of time ordering tests, reading the results of those tests, and then just coordinating follow-up care and talking to the patients about how they're doing in their plan of care. I work 8 a.m. to 5 p.m. Monday through Friday. I don't work any weekends, no holidays. Some of that can be kind of flexible if I know in advance. I can, change my schedule and just not accept patients during certain hours. And that's usually pretty typical. Depending on what you negotiate with your employer, you can set your own hours quite a bit. I don't have an exact figure. I think nationwide the average is somewhere around $65,000 a year. For the Quad Cities, I would say when my classmates and I graduated last year, the average salary offers were anywhere from upper $50,000 a year to maybe lower $70,000 a year for full-time, and then obviously part-time is less. Most places pay nurses in the hospital by the hour, and I think the average salary for a nurse by the hour was around $17, or for a starting nurse, I'm sorry, was $17 an hour, and then the pay got better with experience, and you get paid more for evening shifts, and then you get paid more for night shifts, and then you get paid more on holidays and weekends and things like that. When I first started working in the hospital, I did get, I believe it was a 12-week orientation, and I had a preceptor that I worked with, and in the beginning, she really provided a lot of supervision, and then as I got further and further along in my orientation, I had more that I did on my own and took more responsibility, and I just kind of used her as a resource when I had questions. They did also have a lot of formal classroom things that we had to do, and go to different classes and seminars on different topics. In my educational program, a lot of our time was spent on clinical hours and clinical rotations, so that's where a lot of my training really came from. When I started in the office I'm in now, I spent 2 weeks just kind of shadowing and rotating around with the doctors there, just to get oriented to that particular practice, and then after that I was on my own, and I just asked them questions whenever I need to. I always knew I wanted to go into healthcare of some sort. Originally I started out as a pre-med major, and I thought I wanted to go to medical school. And then I decided I just really didn't want to have to go to school until I was 30 years old. I didn't want to have to be on call all the time and have to work weekends and holidays and have that much of an obligation. And the more I thought about it, the more I really thought that nursing was a better fit. I'm a very caring person, and nursing's a caring profession. I liked that nursing takes a very holistic approach to health and to illness. And then I decided I could kind of split the middle ground by being a nurse practitioner, and so that's why I chose what I chose. Within nursing in general, there's really endless specialties and endless things that you can go into. Just as a general nurse, you can choose if you want to work with babies, if you want to work with children, if you want to work with adults, with just women, with just men, if you want to work with elderly patients. You can choose if you want to go into cardiology and work with heart patients, if you want to go to oncology and work with cancer patients. You can choose if you want to work in the hospital, if you want to work as an outpatient, if you want to do home care. There are different things you can get certified in, like wound care nursing. You can choose to be like a lactation consultant or to work in hospice. And so the possibilities are really endless. And then if you go on to graduate school for more education, you can either be a nurse practitioner, and I chose that because I really like providing the direct patient care, and that way I still get to see patients, I get to provide education to them and their families, but at the same time I have a little bit more autonomy. You could also choose to be like a nurse anesthetist or a nurse midwife or a clinical nurse specialist. There's just lots and lots of possibilities. Well, one thing I like too, and the reason, even within just being a nurse practitioner, you can choose if you want to be a family nurse practitioner, if you want to be a pediatric nurse practitioner, if you want to be a women's healthcare nurse practitioner, a psychiatric nurse practitioner. There's even more that I didn't mention, but I chose family practice just because I liked everything that I did in my rotations. I could never pick just one thing that I liked, and I didn't like the other things. So with family practice, I really get to see kind of a little bit of everything. I get to see people of all ages and with all illnesses, so I really like that. Well, a nurse practitioner is still a nurse. I'm still a registered nurse in both Illinois and Iowa, but a nurse practitioner means that you have extra education and you've passed a specialty board exam. So I can do a lot of things that a regular nurse can't do, like I can prescribe medicine, I can order lab tests, I can order diagnostic tests like x-rays and CTs and things like that. I can basically do everything that you would typically think of when you go to the doctor when you're sick. So I really have a lot more scope of practice and autonomy than a nurse would have. I don't like dealing with insurance companies a lot of the time. Everybody that goes into healthcare thinks you're going to do all this great stuff and help patients, and you don't realize all the bureaucracy that's involved, and you kind of have to do things within a set list of rules. So sometimes that can be kind of frustrating. I think in any occupation or career that you choose, you're sometimes going to have to deal with difficult and angry and challenging patients. And sometimes when people are sick, you see them at their worst. So sometimes that can be kind of stressful. But other than that, I do like my job a lot. There are a lot of different ways somebody could use a nursing degree, even if they didn't want to do direct bedside care, which I think is what a lot of people think of when they think being a nurse. You could open your own business. There have been a lot of nurse entrepreneurs. Seattle Sutton, that operates the Healthy Eating Meal Delivery Company, she's a nurse and she markets that. I got a journal article once where some nurses opened a tattoo and body piercing studio, and people like to go to them because they're nurses. You could be a legal nurse consultant. There are a lot of pharmaceutical drug reps that come to my office that are nurses, that then they go to work for drug companies and they come around and market and promote different products. And even if you don't want to work in the hospital, like I said, you could be an occupational health nurse and work in an office. You could work as a coordinator for like a community health program. You can help coordinate health promotion programs for a county or for a city or for a state. You could work at a school and be a school nurse. You could work for a church and be a parish nurse. There's really lots and lots of opportunities that you could do. It is, in most states it is required of all nurses that you do continuing education to keep your license up. So I have to do that just as a basic requirement, and then as a nurse practitioner I do have to keep up certification, and for that I think it's 300 hours I have to do every 5 years. You can do that by reading journal articles and filling out either a paper or an online test afterwards. You can go to seminars, and there are lots and lots of them around town. You can go to evening programs. There's lots of different things you can do online and self-study programs. I think, one, you do have to truly care about what you're doing. It's not just a job where you can, walk in and kind of do what you have to do for 8 hours and then go home. You do have to care about your patients and do care about the outcomes and be a good advocate for your patients. I think you do have to be intelligent. You have to have good critical thinking and good judgment skills. And then communication, because you really do have to communicate a lot with other healthcare providers and then with patients and then with, insurance companies. So communication is really important. All through my undergraduate education, I did work part-time. I worked as a nursing assistant in the hospitals, at several different hospitals, and that was really helpful. I also, as far as organizations, I was the editor and then the treasurer for the Iowa Association of Nursing Students, and that was good because it gave me a lot of responsibility in looking into some of the more policy and political things that are behind healthcare in general and nursing in general. I never did any specific, internships where you go and you do like a 12-week program or so many week program. I had some classmates that did that, and they seemed to really enjoy it, and I think it helped them get jobs at different places. I'm a member of the Iowa Nurses Association, the American Nurses Association, the Illinois Society for Advanced Practice Nurses, and the Quad City APN-PA Alliance, which is Advanced Practice Nurse and Physician Assistant Alliance. I believe the Iowa Nurses Association, I know they do, they have the Iowa Association of Nursing Students. The National Student Nurses Association is the student branch of the American Nurses Association. And I believe the Illinois Society for Advanced Practice Nurses has student memberships. With a bachelor's degree, if you don't want to go back to school and get a master's degree, you don't have to. You can still advance within the hospital, just in terms of doing more continuing education and getting more seniority within the hospital. You could advance to different departments. You could take a leadership role and be a charge nurse within a department. You could apply to be a nurse manager if you wanted to be a nurse manager. And then once you have a master's degree, you could even you could go on and get a PhD or a doctorate if you wanted to, and work in research or be a professor or different things like that. And with a master's degree, obviously, you get an increase in pay over a bachelor's degree. I would say that the biggest short-term challenges is just from day to day you can never predict what you're going to have. So some days are obviously harder than others, and you can never predict who you're going to have to interact with on that given day. Long-term, I think in general, nurses face a lot of hurdles. People in society don't really realize what nurses do. They think nurses are just the assistant to the physician. They don't really realize that nurses have a contribution that's valuable all on their own. So nursing as a whole is really working, I think, to be better recognized and to have people realize that we do a lot more than just take orders from the doctor and do things that the doctor tells us to do. I think I would take more advantage of, I never did do any of the study abroad programs or different things like that. And I think for anyone, it's fun to do and educational to do while you're young and in college and have the chance. And two, for nursing especially, it's interesting to see what things are like in different countries. I had some classmates that went to Jamaica and got to help deliver babies, and it's just very different the way they do things there than the way we're used to here. So I kind of wish I had done something like that. I would say just take the time and enjoy and take whatever opportunities you have that are available to you. Just that there's so many opportunities available, and I think a lot of people, when they say, oh, I want to be a nurse, or they know somebody that wants to be a nurse, they think all you're going to do is work in a hospital and work in a nursing home. And there's really so many other things you could do with a nursing degree.